Vicki Hogarth at the CHCO News Desk. We will be hearing today from Dr. Russell and Premier Higgs for a COVID-19 update for the province. Now, 4 p.m. is obviously not our usual start time. If you've been following for the past 2.5 years, you're used to 2:30 as being the general time that we do COVID-19 updates. I don't like to speculate, but I'm thinking the reason for the 4 p.m. time is that obviously we've heard announcements all week long from other maritime provinces in terms of when they plan to remove restrictions. So I think perhaps Premier Higgs is just trying to address this for New Brunswick sooner than later, given that a lot of the other maritime provinces have already made similar announcements in terms of their plans. So 4 p.m. today, I'm very curious to find out what he will be saying and what the strategy will be going forward. If you're following online, you can feel free to submit your questions for today. I have a few that I will go over, as you know, before these conferences start. I like to go over what some of the submissions are from viewers for possible questions, and we've received quite a few given the information we're expected to hear today. But if you do have some, as before the conference starts, I'm just going to make sure the sound is good here. 1 second. You can feel free to. I follow on Facebook too, as many of you know who've been following for the past 2 years. Yeah, they're just checking the sound. You can write them on the Facebook chat. I do follow there. If you don't like to see the chat, I know this is a question that many of you have addressed to me in emails and in chats on Facebook. Some of you don't like to follow the chats. So you can always just enlarge the screen. There's an arrow that goes diagonal near where your volume button is. So if you're following on Facebook and you don't want to see the chat, just enlarge the screen and you won't have to see it. Sounds like here. So I'm first. That's exciting. Sometimes that's good or bad. It means you have to like pivot quickly to determine what you're going to ask. So I will be first on roll call for the COVID-19 questions. You can get an idea from the sound in the background, as always, how many journalists are on the line. That'll determine whether we have 1 or 2 questions. I have a feeling, given what we're all expecting, and I know I'm saying this a lot. Hi, Doug. I'm following online. Just so I like people to know that I do follow in real time everything that's going on. So nice to see so many familiar faces. Hello, Jane. Oh, my goodness. Is that it? That is it for today's COVID-19 update. So we will definitely have 2 questions. I have a feeling the reason it's so sparse in terms of the number of journalists is because there was a big conference at, was it 2 p.m.? I'm losing track of time. 2 p.m. today that I was in as well. So many of you are joining me for the second time today on the mysterious neurological syndrome that New Brunswick has been dealing with for, I think, openly for a little under 2 years. Anyway, they released a final report today, if you didn't see, where public health determined that there isn't a mysterious neurological syndrome. They believe all of these people with these cases they're studying, there were 48 that were really studied, can be attributed to something else. So I've put a timeline of those events on our Facebook page if you want to follow, and I definitely will have more information to share with you by the end of today as well. So I like to see what everyone's saying on Facebook. Everyone's saying end to passports. Well, I have a feeling that's definitely something that will be addressed. And Higgs did say last conference, and it was the question that I did ask on behalf of viewers who submitted it, whether he'd consider an end to vaccine passports. And he said that yes, it was definitely something he was considering. And he also mentioned that by end of March, at that time, and this was, I believe, last week, he said he expected end of March to have an end to COVID-19 restrictions for New Brunswick. But to what level does that mean exactly? Brenda today wrote in a question about when will the government be lifting hospital restrictions for visitations? That's a really good question. Since we're seeing that oftentimes hospitalizations, whether we're a certain level in the province, is reflected differently at times in hospitals, and that has a lot to do with the fact that, especially in Omicron, the hospitals have had way more cases than usual. And even now, when we look at 77 people in hospitals today, and we think that's low compared to what we've had in the last few weeks, if you told us that number 6 months ago, we would have been shocked by the idea of having 77 people in hospital with COVID-19, and that's normalized really fast. So Brenda wants to know when if we are lifting restrictions, when will that also apply to hospital visitations? I imagine a lot of you feel the same way about seniors' care homes, long-term care homes. Isolation has had different effects on all of us. It's not just COVID-19 and sickness that's a concern. Isolation can obviously lead to depression and other issues too that we will be obviously dealing with for quite a long time going forward. The recovery from COVID-19 just won't be in terms of cases as we know. It will be how we deal with a lot of the things that have happened because of the 2 years of being in a pandemic. Another issue that I've talked to Minister Shepherd about in other conferences is that a lot of people didn't go get medical help. This is studies that are ongoing right now across Canada and around the world. Certain people haven't sought treatment for certain things in COVID-19 out of fear of going to the hospital, burdening the system. So there could be these other illnesses. For instance, I know that skin cancer was one that was studied. I saw a report on CBC that was really interesting about how there were many less people seeking treatment for early detection of skin cancer. So what does that mean down the road? Will there be, doctors say that doesn't mean there were less cases, it just means they weren't treated. So there could be these more severe issues for many people down the road. And so our COVID-19 recovery, while today definitely, I imagine, will mark a major milestone in what we hear from Premier Higgs and Dr. Russell in terms of where we are and what we choose to do about it. I think today is going to be really significant. That's just speculation on my part, but I really do. But it doesn't mean it's over. It just means that we're going to be living with it in different ways and recovering from it on so many different levels, not just in terms of illnesses. So I did a news report as we wait. It's 4:04, so it's not ridiculously overtime right now. So I'll keep talking until Bruce gives us the heads up that we're going into the conference, and then we will go right there. I've Patrick and Andrew in the back room right now, and they have the video feed from Fredericton. So as soon as we see Bruce go into the conference room, as many of you know, we go right into the conference room. But many of you have been following for 2 years, so I do want to just take a moment to say thank you to all of you who have been so much a part of this, as much a part of it as we are. We might come to you in your living rooms, but you've interacted with us the whole time, brought questions to us that we've been able to raise in these conferences so that we've been able to ask what is important to you, New Brunswickers, and make sure that we ask questions for people like Campobello Islanders who had issues with access to the rest of New Brunswick and things that, you know, especially from a rural point of view, we could really be your voice in these conferences, but it's because you chose to reach out to us and be a part of this conversation that we were able to do that. We are going to go into the conference room right now. I will see you afterwards for a recap, and please send me your questions while it's going on, and I'll make sure to take a look and consider asking them. I'll see you afterwards.
La médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier Ministre du Nouveau-Brunswick. Speaking on behalf of the province in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Good afternoon, everyone. The second winter of the COVID-19 global pandemic has challenged all of us. But because of your diligence and the sacrifices you have made, we are just coming through it. Spring is just around the corner. While COVID-19 is not over, this is a global pandemic which will be with us for some time to come. We are seeing positive signs that this wave of our pandemic journey is behind us. La pandémie mondiale de COVID-19 n'est pas terminée et elle restera parmi nous pendant un certain temps encore. Cependant, nous voyons des signes positifs qui nous donnent espoir que cette vague de notre cheminement dans la pandémie est derrière nous. This most recent phase, driven by the Omicron variant of the COVID-19 virus, has in many ways been the most difficult of our journey. Thousands of New Brunswickers have contracted the virus, and while that experience was relatively mild for many, that wasn't the situation for everyone. Our hospitals have seen hundreds of patients impacted by COVID-19. New Brunswick has recorded more than 150 deaths due to the virus since December 1st. Last month, we called on New Brunswickers to take steps to slow the spread and protect our healthcare system, and you responded. Thanks to your efforts, we were able to blunt the spike in severe illness that could have overwhelmed our hospitals. In January, our modeling projected a worst-case scenario of more than 300 hospitalizations. Because of your efforts, hospitalizations peaked at 165 in the first week of February and have been declining steadily since then. Today, there are 77 New Brunswickers in hospital with COVID-19. Of these, 5 are in an intensive care unit and 2 require the use of mechanical ventilation. New infections continue to be reported, but the numbers, as confirmed by positive PCR tests, have stabilized in the past couple of weeks, as have the reported positive rapid test results. All of this gives public health the confidence to recommend moving out of the winter plan that has been in place to slow the spread of COVID-19 in New Brunswick. Toute cette information donne à Santé publique la confiance requise pour recommander d'abandonner le plan d'action pour l'hiver en réponse à la COVID-19 qui avait été mis en place pour ralentir la propagation du virus au Nouveau-Brunswick. Premier Higgs will speak to our path forward in a few minutes. New Brunswick, like all other provinces across Canada and many jurisdictions around the world, is setting a timetable for the removal of restrictions on public movement that were put in place to slow the spread of COVID-19. While the time has come to lift mandatory restrictions, the COVID-19 virus will still be with us for some time to come. It is likely that there will be a spike in new infections and illness as people move about and interact. Alors que le temps est venu de lever les restrictions obligatoires, le virus COVID-19 demeurera parmi nous pendant un certain temps. Il est probable que le nombre d'infections et de personnes malades augmente au fur et à mesure que les gens se déplacent et interagissent davantage. But after 2 years of this pandemic, we have acquired the skills and knowledge we need to protect ourselves against this virus. Vaccination will continue to be important, and I urge every New Brunswicker to become fully vaccinated and boosted. It is the high level of vaccination among New Brunswickers that has enabled us to avoid the worst impacts of the Omicron wave. You can continue to protect yourself by continuing the basic public health practices we have learned since March 2020 to protect ourselves and others. Wash your hands regularly and thoroughly, and I can't emphasize this enough. Hand hygiene is an excellent, excellent form of protection. Stay home from work and school when you feel unwell, also extremely important. Avoid crowded and poorly ventilated locations, particularly if you are not vaccinated or if you are older, immunocompromised, or have chronic conditions that put you at higher risk of hospitalizations and negative outcomes due to COVID-19. And above all else, get vaccinated and boosted. Our focus will shift to protecting our most vulnerable citizens. Public health continues to recommend isolation for individuals living in high-risk settings like long-term care, correctional institutions, and shelters who test positive for COVID-19. We will also be recommending masking for residents, staff, and visitors in these settings. Nous nous concentrerons désormais sur la protection de nos citoyens les plus vulnérables. Santé publique continue de recommander l'isolement pour les personnes vivant en milieu à risque élevé, comme les établissements de soins de longue durée, les centres correctionnels et les refuges qui obtiennent un résultat positif au test de dépistage pour le COVID-19. Nous recommanderons aussi le port du masque pour les résidents, les membres du personnel et les visiteurs dans ces endroits. You can also expect that the regional health authorities will keep masking and requirements for visitors in place for the time being. They will be guided, as they have been all along, by their infection prevention and control leads. This will help limit the spread of the virus amongst those who are most susceptible to its effects. Moving to this next phase may be difficult for some of you. It is important to understand that as a society, we are well equipped to move to the next phase of our pandemic journey. We have a high rate of vaccination, particularly in the older age groups that have proven most vulnerable to the virus. We have 2 years of experience that enables us to know our risks and respond to them. We know how to protect ourselves, our loved ones, and our communities. Le taux de vaccination est particulièrement élevé parmi les groupes d'âge plus vieux, soit les personnes qui se sont avérées les plus vulnérables à ce virus. Notre expérience des 2 dernières années nous permet de bien connaître les risques et d'intervenir en conséquence. Nous savons comment nous protéger et nous savons comment protéger nos êtres chers et nos collectivités. By practicing what we know and looking after those who are least able to look after themselves, we can move into this new phase with confidence and security. Thank you very much. Merci.
Good afternoon. Bonjour. Well, this is a good day for New Brunswick. It's certainly not a good day for democracy, diplomacy, and world order. I'm speaking particularly of the events that are happening in Ukraine and with the invasion of Russia into that country. I recognize the world's eyes are on the region. On behalf of all New Brunswickers, I want to condemn the violent actions that Russia has taken against Ukraine. We support our federal government and all the sanctions they are taking against Russia in the response to this action. We also support the actions taken by Canada to support Ukraine in any way possible, to support our allies and sending troops or resources of any kind to be deployed in Europe in support of NATO. More than 3,500 Brunswick residents are of Ukrainian descent, including some who were born in Ukraine. I can't imagine how hard it is to watch what is happening, worrying about your family members, worrying about what comes next, and trying to stay in constant contact. I want you to know that all New Brunswickers, as well as all Canadians, stand with you and vehemently oppose the actions of Russia. We must be strongly united with our allies, and we must resist any act of aggression that threatens our world's peace. Thank you. For almost 2 years, we've been living with COVID-19 pandemic. While it hasn't been easy, New Brunswickers have risen to every challenge that our province has faced and taken the steps required to keep ourselves, our loved ones, and our communities healthy and safe. When decisive action was required, we did not hesitate, and when possible, we eased public health measures. Throughout, we tried to find a balance to keep our economy moving while protecting New Brunswickers and our healthcare system. Quand il était nécessaire de prendre des mesures décisives, nous n'avons pas hésité à le faire. Et lorsque c'était possible, nous avons assoupli les mesures de la santé publique. Tout au long de la pandémie, nous avons essayé de trouver un équilibre pour continuer à faire rouler notre économie, mais aussi pour protéger les gens de New Brunswick et notre système de santé. Last week, we were able to move to level 1 of the winter plan to manage COVID-19. This was a major step towards reducing public health measures in our province. I am very pleased today to be able to say that, as demonstrated by public health modeling, the number of hospitalizations continues to trend downward, putting less strain on our healthcare system. Horizon and Vitality say they are managing the situation and are actively transitioning back to normal operations. Les ressources de santé, Horizon et Vitality disent qu'ils gèrent la situation et qu'ils font activement la transition vers un retour à la normale. We are now in a position to ease out of our winter plan. On the advice of Public Health, Cabinet, COVID Cabinet, we've agreed to make the following changes. First, as of 12:01 a.m. on Monday, February 28th, proof of vaccination will no longer be required anywhere it is currently required, such as restaurants, gyms, entertainment centers, and churches. Other measures, including masking and physical distancing, must continue to be followed. Then, as of Monday, March 14th at 12:01 a.m., the mandatory order will end. At that time, all mandated public health measures will end. Masks will no longer be required in public spaces, indoors or outside. Capacity limits will be eliminated and physical distancing requirements will end. Isolation requirements for COVID will end. Le port de masque ne sera pas obligatoire dans les endroits publics, à l'intérieur et à l'extérieur. Les limites pour la capacité d'accueil seront éliminées et les exigences concernant la distanciation physique vont prendre fin. Les exigences des éléments relatifs à la COVID-19 vont également prendre fin. In alignment with the termination of the public health measures, public health will also lift all measures in the public school system. However, students and staff who wish to continue wearing masks, just like anyone else, will of course be able to do so. We need to recognize that some will be more comfortable with these changes than others, and some will need the added protection masking will give them. For the Government of New Brunswick employees, as with many other businesses and organizations, vaccination became a condition of employment for new hires due to the occupational health and safety requirements. For existing employees, a mandatory vaccination policy was implemented, and those who decided not to get vaccinated after a defined period of time were put on leave without pay. As we lift measures, we will be looking at all our pandemic policies, including mandatory vaccination for existing employees. The requirements for vaccination as a condition of new employees will remain. As public health measures are lifted, reporting of COVID-19 information will be moved to the communicable disease section of the public health website. Beginning in mid-March, this information will be updated weekly and moved from the COVID-19 dashboard to the public health website. À compter de la mi-mars, ces renseignements seront mis à jour une fois par semaine et ils seront publiés sur le site web de la santé publique plutôt que sur le tableau de bord de la COVID-19. I want to be clear that we are in a position to be able to lift measures because a majority of New Brunswickers have done the right things throughout this pandemic. When asked, you followed public health measures and you got fully vaccinated and you're now in the process of getting your booster dose. You did this because you understand that it is about more than individual rights, that each of us has a responsibility as a resident of this province to do the right thing. You are the reason we are able to take this next step. It was the sacrifices of the majority that got us here today. Vous êtes la raison pour laquelle nous pouvons passer à cette prochaine étape. Ce sont les sacrifices faits par la majorité de la population qui nous ont permis d'en arriver là. While measures will be ending, we must remember that COVID is still with us. We know who is at the highest risk from this virus. If you are over 50, if you have underlying health conditions, if you are immunocompromised, you are at a higher risk of not just getting COVID, but of dying. And I urge you to protect yourself by getting vaccinated and boosted. Si vous avez plus de 5 ans, si vous avez des problèmes de santé sous-jacents, ou si vous êtes immunodéprimé, vous êtes plus à risque de contracter la COVID-19, mais également de mourir. Je vous demande de vous protéger en vous faisant vacciner et obtenant votre dose de rappel. Currently, 86.8% of eligible New Brunswickers have 2 doses of COVID-19 vaccine, and 49.6% have received a booster dose. We are in a good position in those age brackets. For those 50 and over, 96% have received 2 doses and 74.6% have received a booster dose, while for those 65 and over, 85.5% have received a booster dose. We can't wait for everyone who should get vaccinated to do so. People must make their own choices and know their risks. I understand that some may have mixed feelings about the end of mandated requirements. Not everyone will be ready to see restrictions lifting on March 14th. We will all have to adapt to this new environment at our own pace. Some will welcome the change, while others may continue to wear a mask and limit their number of contacts. Those at higher risk, or those who are around anyone at higher risk, should take the right steps for protection. Certaines personnes vont être heureuses de ce changement, alors que d'autres personnes pourraient continuer à porter un masque et limiter leurs contacts. Les personnes qui sont plus à risque et celles qui sont des contacts proches des personnes plus à risque devraient prendre les mesures nécessaires pour se protéger. Everyone must do what they feel is best for them. Please be respectful of one another's personal protective habits and tolerance to risk in the days ahead. Though the past 2 years have been challenging, we have much to be proud of in our province. In many ways, the pandemic has shown us just who we are and who we can be. When called upon, New Brunswickers work together to protect and support one another. De bien de façon, la pandémie nous a montré qui nous sommes. Les gens de New Brunswick ont répondu à leur appel. Ils ont travaillé ensemble pour se protéger et pour se soutenir les uns les autres. I hope we take the sense of resiliency and determination that we have discovered, as well as the compassion that we've shown to one another, with us as we take this next step. Thank you. Merci.
We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans les langues officielles de votre choix. Chaque journaliste a une question et un suivi. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. This question is for both Dr. Russell and Premier Higgs. To what degree should we expect to see cases and hospitalizations rise as we end restrictions? And is there a threshold or a point in terms of hospitalizations or even case numbers that could lead to restrictions being reimposed? Or should we just see this as probably the end right now of restrictions?
Hi, Vicki. We are very hopeful based on the modeling right now that we can safely remove the measures moving forward. We do have, again, the modeling is showing us that we will probably see some increases here and there, but we're not expecting that they're going to be overwhelming. And the things that we have in place for looking after vulnerable populations through the Public Health Act, et cetera, that's where we're going to be focusing our attention.
Ms. Hogarth, do you have a follow-up?
Thank you, Bruce. It's for Premier Higgs. I'm just wondering what made you decide to go with removing the mask mandate. It hasn't necessarily been picked up by every province yet, but some have made that decision as well. And if possible, I'd love for you to just clarify a little bit. You mentioned that some people who were terminated due to not being vaccinated could be brought back to work. I missed part of that. I wondered if you could clarify if you knew who could be at this moment in time.
Sure. I think in relation to the masking and the recommendations and working with public health and looking at the risks going forward, and as you're pointing out, it varies in certain areas. All of this relates to our ability in our hospitals to manage. We've seen high transmissions of the disease, certainly the Omicron over recent weeks, but not resulting in hospitalizations. So it comes down really to a personal choice. And going forward, I think we continue to emphasize the best defense is being vaccinated. And then if you feel comfortable wearing a mask, then you should do so. Don't ever, feel uncomfortable wearing a mask in any public place or when you feel you should do so. But the point is that we are, it's been recommended that we can move now to a more open society and manage COVID as we have managed other diseases, and that our province and our hospitals can maintain and get back to normal with their treatments in other areas of concern for our residents. So that brings us to the freedom of movement once again in our province. And I'm pleased to see this recommendation and certainly pleased to accept it because it allows us to to see our province be rewarded for the activities of so many, the majority of people during this pandemic. So it's important that we move out of COVID and find ways to live with it and beyond it.
Thank you. Natalie Sturgeon with Global TV.
Thanks, Bruce. Premier, when you speak in your speech, you're talking about what it seems like there's a subset of population who are going to be vulnerable to catching COVID even as we move forward. I wonder if you have a plan for those folks who are immunocompromised or who may be vulnerable to COVID-19, and can they be assured that you have their best interests as you're lifting mandates without any sort of precautions for them in the province?
I would say that, you know, as we have indicated, vaccinations would be certainly the primary protection for all. Certainly in the vulnerable age groups, but even more in the case of people with compromised immunities. The point we've become has always been in our health system that there has to be a personal, recognition of concerns and guards that are taken in that. And that applies to not only individuals, but in terms of family members who are exposing potentially their loved ones to unnecessary risk. That is applied to health concerns for years and years. Whether if you had a cold or you had the flu and you decided, well, I'm not going to go visit my grandparents because I don't want them to catch that. I'm not going to visit my mom and dad because I don't want them to catch that. So as we move forward and saying, we have vaccinations to protect those that choose to take the vaccines, and we have lots of them, there does become a personal requirement for individuals to say, okay, I can do my part, and we understand that society has to move on, and that's always been the case. So let's just look at this as at this point in time, what's being recommended is that we can manage living with COVID. And we're seeing it across our country. We're seeing it across North America, across the world. And so we are finding ways to do that like every other province and country. And it's important that we do so.
Ms. Sturgeon, do you have a follow-up?
Yes, I mean, in the summer, we also found ourselves sort of out of the woods, I guess you would say. We're here again. How confident are you in the modeling that we won't end up in a situation like we were with the fifth wave of the pandemic?
So, Dr. Russell may want to comment to this as well, but we have worked together as a team for 2 years in identifying what were the right best steps for the province. And all the while trying to balance what the public would adhere to in terms of rules and regulations and make it palatable. Because at the end of the day, if the public are not part of the solution, enforcement will never be the answer. And we recognize that. We recognize that trying to manage and keep businesses open as much as possible because we had to survive this in a way that got us beyond COVID. And so when you look at that, there are many things you can look back and say, well, if I'd have known something differently 2 or 3 or a month or 2 later, I would have made a different decision. And I could probably go through a lot of my time in the past and say, yeah, I may have changed certainly certain things. And we learned from all those experiences, and we learned from, we got better through COVID, I think, identifying what are the risks, what are the rewards. And that's where we are today with, making a path forward decision based on our best recommendations and based on, of course, what we're seeing from others throughout our country.
And I can just add to that, just to echo that, again, right now we're basing our information on what's happening currently in our jurisdiction and what we're seeing across the country. That's not to say that there aren't going to be more variants that are going to emerge. That's not to say that there won't be more surges that happen, but we will continue to use all of the protection measures that we have right now, which are recommending that people get vaccinated, recommending that they get boosted, continuing with really good hand hygiene, masking for those people who choose to, whether it's for yourself because you are vulnerable or you live in a household with somebody who's vulnerable. We definitely want to make sure that there is no stigma or judgment around who who uses which types of protection, whether it's vaccination, whether it's masking, whether it's hand hygiene, physical distancing, and staying home when you're sick. Those are really important. So I think if we haven't learned those lessons after 2 years, then I don't think we've done a good job at making sure that people understand what the risks are and understand how to protect themselves as individuals and to protect their families and their communities and the hospital system. So we all have a role to play here, and I do encourage everybody to actively play a part in moving forward right now. But again, that's not saying that the pandemic's over. That's not saying that there won't be surges in the future or different variants.
Thank you. Louis-Philippe Morin avec CHCO-TV. Savannah Odd with the Telegraph Journal.
Hi, can you hear me okay?
Yes, a little louder, please, Savannah.
Yep, for sure. So you both spoke to some stats around hospital admissions decreasing, but in school settings, we've seen cases increasing to a pretty concerning degree. There were about 4,000 students that caught COVID over 7 school days recently. Was this part of the decision making, this statistic in particular? And I guess why not leave certain measures in schools? I guess what is the harm in doing that as part of this plan?
Is that for me? Okay. So the modeling that we were using really revolves around the hospital system. We were aware that during this wave, we would have many cases of COVID. We were aware that those most vulnerable, meaning people who are elderly, who are above the age of 65, actually, I don't mean to say that everybody over the age of 65, that's the definition of elderly, but certainly the older you are, the higher your risk of COVID. And if you have any comorbid conditions, like other chronic medical conditions that compromise your immune system, et cetera, or if you haven't been vaccinated with 1, 2, or your booster dose. So those are the things that we know are most at risk, that increase your risk for being hospitalized. And so that's why we're not basing our decision on the number of cases. It's really the context of the cases in terms of the hospitalization numbers.
Ms. Odd, do you have a follow-up?
I do, thanks, Bruce. This one, I guess, would also be for Dr. Russell. I know the new hospital admissions, like you said, is a pretty big factor in this decision. Can you share what the recent trends are with that? I know it's not on the COVID dashboard, so can you share those numbers in terms of how that's decreased and why it's decreased enough for you to be confident in this decision?
So the good news about the modeling is that with everybody who followed the level 3 measures, we were able to really keep the peak really low in terms of the hospitalization numbers. So as I mentioned, I think they were predicted to be above upwards of 300. They capped at about 165, and they've been steadily declining since then, which is really great to see. Now we did have one of the modeling graphs, or one of the, oh my goodness, my poor brain. One of the modeling graphs depicted that we would have a second peak with a second peak of hospitalizations, a second peak of cases with a second peak of hospitalizations. But at this point in time, we're not seeing that. And if we do see it, it's really expected to be small in terms compared to what we were looking at before we implemented the level 3 and then the level 2 changes. So as of right now, we're in a good place. Things are manageable within the healthcare system. We meet with the CEOs of Horizon and Vitalité quite regularly to go through these changes in the data and what we're experiencing.
Thank you. Aidan Cox, CBC.
Hi, can you hear me?
Yes, thank you.
So long-term care residents continue to be affected by COVID-19, but also the isolation that comes with the lockdown when an outbreak is declared. As the government continues on this shift with living with COVID, how might rules in long-term care homes change in the way they can manage outbreaks while allowing residents to maintain their quality of life by, for instance, continuing to see family?
So in terms of what's going to be happening in long-term care facilities, the masking is going to continue to be important, obviously. And my understanding with conversations with some of my medical officers recently is they were looking at, if they haven't already, changing how that isolation looks in terms of how it's done. So I'm obviously in a vulnerable setting, it's really important to make sure that those things are followed. But we also know that, prior to COVID, that they had protocols around flu and what they did. So we're making sure that we're balancing what the risks are with how that impacts residents in those settings. We are expecting to see an increase in flu cases this season. Particularly next fall, most jurisdictions are gearing up for seeing a rise in flu cases moving forward as well.
Thank you. Mr. Cox, do you have a follow-up?
Yeah, I mean, it's kind of been asked already, but we saw the restrictions get lifted last summer, only to be reimposed again in the fall. Is the government prepared for this possibility, and what is the exact benchmark for, that happening at all?
I can start, actually, and if the Premier wants to jump in. We're in a very different place than we were last summer in terms of our vaccination rates, including booster shots, including the ability to vaccinate children as young as 5. So all of those things combined have really changed where we are right now. The Omicron variant obviously has changed where we are right now also. So given the information that we have today, we can only talk about what's happening right now. Moving forward, as I mentioned, the pandemic is not over. It's not going to be over until the World Health Organization declares that it's over. So in the meantime, if there are surges with new variants, again, we will have to address those situations moving forward. But we do know that in the future, we are looking at globally and at the federal level what is happening with new vaccine developments. There was just an announcement today about a Canadian vaccine that was approved for use. And my understanding is there are going to be shipments of that available, I believe, in May. So different technologies for vaccines will be coming, and more information around boosters, et cetera, will provide us with better information about what we can do moving forward with new variants and new surges.
Premier?
Yes, and I think in addition to what Dr. Russell has just stated and echoing those comments, but in relation to reacting to the issues of the day, I think we've demonstrated that over the past 2 years. We'll continue to work collaboratively to make the right decisions. I think we've learned a lot through the experiences and in relation to our vaccine levels. And if you recall, there were times trying to understand what was the right herd immunity to prevent a massive transmission, and where should we be? And then it got right down to hospitals and how can we manage in our hospitals to deal with outbreaks, and to what level of the outbreaks can we manage. I think through all this we've become stronger, and I would say that we've also understood where we have weaknesses. And weaknesses in our medical system and our hospitalizations have been identified not only in New Brunswick, but across the country. So the challenge we have right now in coming out of this is not only watching what happens, in terms of a further risk, but also how we strengthen in the areas that we found us being vulnerable in the past. And that is how we work together in our hospital networks with Vitality and Horizon, and how we build a strength that can rival any healthcare system in North America. And that's certainly where we're headed. And I think the pandemic has taught us that we have opportunities in that regard. And I'm excited about the people that are working to achieve a better outcome for our health for all.
Thank you both. Rachel Huizinga, CBC.
Thank you. My question is for either the Premier or Dr. Russell. Supply teachers have been deployed in school districts across the province over the past month to assist with staff shortages due to self-isolation requirements. Will these supply teachers still be available after the March break?
I think that's a question for EECD. I'm not aware of their policies around their staffing.
Thank you. Do you have a follow-up, Rachel?
Yes, I do. I believe Savannah asked this question earlier, but I'm not sure if it was directly answered. Would you consider keeping any masking requirements in place or other requirements in place in schools with the amount of cases we're seeing among school children, or perhaps until vaccination rates among that age group are higher?
I think with what's being proposed here today, there is an opportunity to have masks for those who choose and want to continue to wear masks, but the recommendation is that we can proceed without masks in children. We've had high case counts, but not certainly high hospitalizations or an issue that has caused major concerns with health of children. So the recommendations are that it would not be required after the 14th. And Dr. Russell, do you want to add anything to that?
I don't have anything to add.
Thank you both. Pascal Rochnog avec Radio-Canada.
Oui, bonjour. Ma question est pour la médecin hygiéniste en chef. Vous et M. Higgs avez parlé pendant le point de presse du fait qu'on change d'approche. Vous passez de règles, d'obligations, de réglementations vers quelque chose qui est plus de la responsabilité individuelle. Pouvez-vous m'expliquer dans vos mots quelles sont vos attentes pour les gens du Nouveau-Brunswick à compter du 14 mars, lorsque toutes les règles seront levées? Qu'est-ce que vous voulez voir de la part des Néo-Brunswickois en termes de mesures, de précautions?
Moi, j'aimerais voir que tous les gens qui sont éligibles pour se faire vacciner ou pour leur dose de rappel se fait leur rendez-vous. J'aimerais que les gens continuent à laver leurs mains. C'est une précaution très importante. J'encourage les gens qui sont vulnérables de porter les masques encore, ou si vous demeurez avec des gens qui sont vulnérables, c'est quelque chose encore qui peut nous protéger. Et aussi, si vous voulez continuer à faire la distanciation physique, etc., c'est des choix qu'on peut faire comme individu, mais on sait que la protection, c'est pas juste pour les individus, ça va être pour la communauté et les hôpitaux, les hôpitaux.
Merci. Puis ma question de suivi, c'est pour le premier ministre. Monsieur Higgs, pouvez-vous nous expliquer qu'est-ce qui va arriver, qu'est-ce qu'est le timeline pour les fonctionnaires qui ne sont pas pleinement vaccinés? Est-ce qu'ils pourront revenir au travail le 28 février ou est-ce que ça va être le 14 mars? Comment ça va fonctionner concrètement?
Well, certainly we haven't made a decision in regards to when they would be able to return to work and under what conditions and if they'll be able to return to work. That's being analyzed right now in relation to not only those that were not allowed to continue work because of the vaccination status. As I indicated, we have a policy in terms of new hires, but also there will be additional restrictions that will always be in place for those that work in maybe in relation to the health field, and that'll be a decision that'll be made by Horizon and Vitality in that regard. But as a employer, the conditions of employment will always be, I guess, an obligation or a right of the employer. We will over the coming weeks, so I won't put the February 28th or the March 14th date on either of the decisions in relation to current individuals that are not here because of the vaccination requirement, or what our policy would be going forward. However, we are working on that, and I would say it will come over the coming weeks, but I won't tie it to the particular dates that are identified here today.
Merci.
Merci beaucoup, Monsieur Rachnog. Thank you, Premier. Thank you, Dr. Russell. Voilà la fin de notre mise à jour.
That concludes today's COVID-19 update for New Brunswick with Premier Higgs and Dr. Russell. Obviously, so much to take in today. A lot of you online that I'm following are extremely happy with the news. Some are feeling cautious about it, but just for a quick recap, February 28th, that's this Monday, there will be an end to the vaccine passport system in New Brunswick, so there will be no more requirement to show proof of vaccination in the province. I will post all the details in case you want to read all the details of what exactly that means. I will have those within the hour on our Facebook page. Bigger news, March 14th, that will be the end to the mandatory order in the province and also the end to masking. So New Brunswick is following suit. Newfoundland obviously made that announcement just yesterday, I believe, and New Brunswick will be doing the same starting March 14th. So a lot of changes. I don't know if this means this will be the last COVID-19 conference. I have a feeling there will be other updates similar to this just as we progress. Obviously, as we move to removing restrictions, there will be an increase in cases, hospitalizations, and we will navigate that and the possibility of new variants as it comes. So I will be here in case these COVID-19 updates do come up again. But in case they don't, let me take a moment right now to just thank you all for, I almost cried, 2 years of you being a part of these with us. It feels weird to feel emotional about this, but I do, because it definitely has reminded me what it's like to live in a province full of neighbors who look out for each other. And while there have been times it's been heated in the online conversation online, I can never get over the amount of you that reach out either by phone, email, Facebook to share what your thoughts, questions are. We've done our best to represent you in these conferences, and it's been the honor of my life. I'm sorry for crying, but I really will, in a weird way, miss this so much. So thank you for choosing to watch with CHCO. I mean that from the bottom of my heart. I'm Vicki Hogarth at the CHCO News Desk. I will see you if there is a next time. Bye.
This has been a news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.